Muscles of the medial compartment of the thigh. Today we are going to discuss about the muscles of the medial or adductor compartment of the thigh. This is the cross section of the right thigh. You can see the adductor or the medial compartment located in between this anterior compartment and the posterior compartment. So the separation of the medial compartment from these two compartments, we can see there is a septum called medial intermuscular septum between the anterior or extensor compartment and between the adductor compartment. This is the medial intermuscular septum. This septum is somewhat thin and weaker than the lateral septum. The septum located between the vastus medialis and the adductors and the pectineus muscle. You can see there is no clear division or septum dividing the posterior compartment from the adductor or the medial compartment. So only two septum dividing the compartments of the thigh. Those are medial intermuscular septum and the lateral intermuscular septum. When we talk about the muscles of the medial or adductor compartment, we can identify 5 muscles. First one is gracilis, then adductor longus, then adductor brevis, and adductor magnus, and the deeper obturator externus. So this is the cadaveric image of a dissected body showing the medial compartment muscles. Now you can clearly see, if we see from the medial aspect, this is the most superficial muscle, which is the gracilis muscle. It is a long muscle extending from the pubic region towards the distal end of the thigh, and this is the adductor longus muscle. The muscle is cut and reflected here. So this is like located above this adductor brevis and pectineus, and above the adductor magnus as well. So beneath the adductor longus, this is the adductor brevis cut section, and this is the pectineus muscle. You can see the attachment, and this muscle beneath all the adductors is the obturator externus. So the adductor magnus is a large muscle. It has a broad attachment as well. So these are the 5 muscles we are going to discuss. And the artery for this adductor or medial compartment is the profunda femoris artery, the deep branch of the femoral artery. And this artery is assisted by the obturator artery with regard of the blood supply of the medial compartment. And the nerve is the obturator nerve. This is for you to understand of the muscle origin and attachment of the medial compartment. First we talk about the gracilis, denoted by number 6. So the origin is from the inferior ramus of the pubic and the adjoining ischial ramus, somewhere there. It inserts into the upper part of the medial surface of the tibia. The number 4 is the adductor longus muscle. It originates from the circular area on the body of the pubis in the angle between the pubic crest and the symphysis, and it inserts into the middle third of the linea aspera. Number 3 is adductor brevis, where it originates from the inferior ramus and the body of the pubic bone. You can see its origin somewhere below than adductor longus and gracilis. And it inserts into the upper part of the linea aspera. Adductor magnus muscle, a large muscle. This is the muscle numbered by number 5. You can see it has a somewhat wider origin than those muscles we discussed, and actually it has 2 parts. It's a composite muscle, so it has 2 parts. One is hamstring part, origin from the ischial tuberosity somewhere there, and the adductor part origin in continuity with ischial origin from ischio-pubic ramus. It attaches to the adductor tubercle along the linea aspera to the medial supracondylar line and up to the gluteal tuberosity. Obturator externus muscle is not mentioned here. The obturator externus muscle is not indicated in here, but it arises from the whole of the obturator membrane located here and from the anterior bony margin of the obturator foramen, and it inserts into the trochanteric fossa located posteriorly of the upper part of the femur. The gracilis muscle is the first muscle we are going to discuss. So this is the muscle, and it located more superficially in the medial side of the thigh, and the muscle from its origin narrows in a triangular fashion and is replaced by a cylindrical tendon towards the distal side, and its arterial supply is from medial circumflex artery, profunda femoris and femoral artery. This muscle can be used for the perineal reconstructive surgery. In the adductor longus, we discussed the origin and insertion. So this origin can sometimes be ossified and called rider's bone. Adductor brevis here, we also discussed the origin and insertion located somewhere beneath the adductor longus muscle. The anterior division of the obturator nerve passes vertically downwards on the surface of this muscle, and posterior division of the obturator nerve descends behind this muscle. So the upper border of the adductor brevis lies between the two divisions of the obturator nerve, anterior division and the posterior division. Now we just mentioned the origin and insertion of the adductor magnus muscle. This is a composite muscle. It means it has two parts which supplied by two different nerves. Actually, the hamstring part supplied by the tibial part of the sciatic nerve, and the rest of the magnus muscle is supplied by the posterior division of the obturator nerve. So up to now, the gracilis, adductor longus and adductor brevis all supplied by the anterior division of the obturator nerve. Now the upper border of the adductor magnus lie edge to edge with the lower border of the quadratus femoris, and the medial circumflex femoral artery passes between two muscles from front to back to reach the cruciate anastomosis. Although these adductor muscles are large, but they are less important in the prime movement of adduction, but rather they associated with posture and gait. The obturator externus muscle originates from the whole of the obturator membrane and the anterior bony margin of the foramen and inserts into the trochanteric fossa. So this muscle also supplied by the posterior division of the obturator nerve. So we discussed about the muscles of the medial compartment. This compartment is separated from the anterior compartment by the medial intermuscular septum, and there is no clear demarcation between this medial compartment and the posterior compartment of the thigh. So we learned about the muscles, we learned their nerve supply and the muscle action. So thank you very much and stay tuned with Anatomy Everywhere.